Hi, everyone. Thank you so much for joining us today. We will get started in just about 2 minutes. Thank you for joining us, everyone. We will be starting in just about 1 minute. All right, we're going to get started now. Thank you so much for joining us today. This webinar is on how to find internships and research opportunities. And we have a few of our international student ambassadors and current interns and researchers with us. So we're really excited for this webinar today. Thank you so much for joining us. My name is Paul Notar. I am the Senior Associate Director of International Admission, working in the admission office at Massachusetts College of Pharmacy and Health Sciences. It's possible that I've spoken to some of you previously. I work with many international student applicants, so you are more than welcome to contact me if you need help with your application or if you have questions about studying in the United States, life in Boston, things like that. Our contact information will be on one of the slides towards the end. You're more than welcome to contact me. A few kind of housekeeping items. Please keep your microphone muted throughout the webinar unless you are a panelist. And for the panelists, please keep your microphones muted unless you are speaking. Please type your questions in the Q&A box, and we will address them as we go through, as we can. After the webinar, you will receive a recording as well as a survey, so please tell us what you thought. Please take time to answer the survey questions because your feedback is really valuable to us. All right. So we have an audience today really from all over the world. MCPHS is really an international university when you think about the students that come to our school, the programs that we have overseas, the clinical placements that we have all over the world. We were founded 200 years ago, actually 201 years ago, and we have grown to become one of the world's most comprehensive health sciences universities. We offer over 100 academic programs in various professions of health sciences. That includes things like healthcare practice, research, healthcare business, as well as technology and healthcare administration, and as well as the life and biomedical sciences. So we are the locus of expertise in the field of healthcare education, one of the few universities in the United States that focuses exclusively on the health sciences and related careers. So rooted in this expertise that we have created this wonderful webinar series for you to assist students, applicants, and their families who are contemplating a program in one of these many areas. We realize that you are potentially in the process of deciding which university is the best fit for you. And we hope that with today's webinar, we can help you understand how our students forge ahead in their careers and how they leverage the internship and research experiences to improve their CVs and become strong applicants for the next step in their careers, and how you can too. We're going to be discussing what are the right questions you should be asking before choosing a university. When you were just starting out, when you were just starting to look at career options in universities, the questions and potential choices can seem a little bit overwhelming. And it's not easy to know what questions to ask or what really what to look for. So that is really what this webinar is for, is to help you ask the right questions of your future university, your future academic program. The last thing I'll mention before we introduce the panelists is location is really, really important when choosing a university, because it is the firsthand experiences you have, your internships, your research, your job placements. All of this is really important, not just your academic coursework, but your firsthand internship experiences will strengthen your resolve to continue on in healthcare. We all know it's very challenging. I was just talking to Carbonali about his organic chemistry class. It's, you know, this is very challenging work, and you really have to be motivated to do it. These types of experiences that you get outside of the classroom really strengthen your resolve to continue in this field. The Longwood Medical Area of Boston is really the preeminent destination for the world's best scientists and healthcare practitioners. Along with Cambridge, which you'll see just across the river in the back, is along with Cambridge and the Longwood Medical Area, Boston is the U.S. hub of healthcare education and innovation. Some of the world's best scientists, hospitals, research labs are all located within either walking distance or within a short train ride of our campus. Every year, MCPHS receives many applications for students pursuing careers in medicine, health, research, biology, chemistry, etc. The clinical side of these pursuits, which means, you know, treating patients, that might be something that is top of mind to you, kind of like the tip of the iceberg, what you see and what you experience when you go to a hospital. But really, there's much more happening below the surface. So we're going to really dig into a lot of that today, especially as it pertains to 3 of our students and what they do for their internships. What I really value about MCPHS is the faculty's willingness to assist students in their exploration. We have clinical placements and internship placements at most of these organizations that you see here in the Longwood Medical Area of Boston. So if you're interested in things like research and disease prevention, epidemiology, perhaps, healthcare business and technology, securing, organizing, and maintaining data as it pertains to hospital systems and pharmaceutical companies and clinical trials and things like that. If you're interested in a more traditional clinical practice like nursing or medicine, or if you want to look at something like the biomedical sciences, more kind of pure research, these are all areas that we specialize in. So we're confident that this comprehensive training that you receive both inside and outside the classroom will make you a strong applicant for either your first job or graduate school or professional school, like, for example, medical school. So with that, I'd like to introduce our three panelists, Ashna, Alicia, and Kurbanali. You'll see that only two of them are joining us today because Ashna is not able to join us, but we're going to hear a short video from Ashna, and then I'll hand it over to Alicia to introduce her her background and her internship. So with that said, let me show Alicia's video.
Hi everyone, my name is Ashna and I'm currently a fourth year medical and molecular biology student here at Massachusetts College of Pharmacy and Health Sciences, Boston. I am an Indian by citizenship and I speak a lot of languages. I speak Gujarati, Kutchi, Marathi, Hindi, English, Spanish, and French. I'm going to be mainly talking about my role as a clinical research intern at one of the biggest hospitals in the country, Massachusetts General Hospital, and I worked for their Center for Women's Mental Health. I will also touch upon some of my other experiences that are more along the lines of a clinical experience, but I will tell you everything about my journey. I started working in the Center for Women's Mental Health in an internship during my summer, where I worked on their research project called the National Pregnancy Registry for Psychiatric Medications. It involved screening and treatment enhancement for postpartum depression within the Mass General Brigham system. It also involved me to create blog posts for the Center for Women's Mental Health website because I expressed interest in creating marketing and social media material, and this gave me an opportunity to summarize actual scientific research. This is one of the blog posts right here. It was one of the blog posts I created. I also engaged in creating social media content for Massachusetts General Hospital's Psychology Academy, which is basically a repository centered towards information on postpartum depression and pregnancy for physicians all over the world. Here, this is a picture of me in another experience of mine where I worked in a lab on campus under one of our very own MCPHS professors, Dr. Patri, in his lab and on his research in dysferlinopathy, which is a kind of muscular dystrophy. Going back to my internship at Massachusetts General Hospital, and even just any of my experiences within research in general, I have found that creating a niche for yourself or finding a niche where you learn about your own interest and what is going on in the city or in the country and how you can match yourself to whatever's been going on and see if your skill set or your interest can benefit not only you but also any center or any lab that you contribute to. That's what I did. I wanted to build upon my laboratory skills, which is why I contacted all the labs at my university, all the professors doing research, and I ended up working with a professor that was willing to not only teach me molecular biology lab techniques, but also teach me a lot about lab management, data analysis, data collection, and get me involved in his research, like his lifelong research. Similarly, with my internship experience at Massachusetts General Hospital, I have been very interested in psychiatric disorders, and I found postpartum depression very rare and less talked about, especially considering everything else that happens to pregnant women. What I usually do was cold email and cold call various mental health centers. This was one of the centers I cold emailed, after which I submitted an inquiry to them on their Contact Us page. And I sent over my resume, a cover letter, and one of the papers I had written in class about paternal postpartum depression to kind of reinforce my interest. I had about 3 rounds of interviews, and after which I was able to secure that internship. In order to maintain my F1 status, I enrolled in a class on campus known as Undergraduate Research Project, which allows for you to conduct research under a professional or under a center as an undergraduate student researcher, and lets you engage in actual research while still having undertones of your academics and curriculum that you're currently taking. In order to do that, I worked with our international services to ensure that I was compliant. I was working on my CPT, which is curriculum practical training, and I had it on for about 1 semester for my internship at MGH and about 2 semesters for my work as an undergraduate research assistant in the lab on campus. You should always, 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 in any experience you take, talk to the international services before committing to anything, because they are usually there to help us and help advocate for us and our opportunities going forward. Coming to one of my most favorite parts about MCP and the experiences that I've gained from this university is my clinical experiences. I am currently gaining everything I can, research and clinical experiences to go to medical school. So this was one of my most enriching experiences. I worked as an operating room attendant at Beth Israel Deaconess Medical Center, which is also one of the biggest hospitals in Boston, where I worked in the operating room as one of the staff that helps facilitate surgeries and collect materials, collect specimens, biological specimens, and help sanitize and maintain the operating room. And I also currently work as a medical assistant at a urgent care in downtown Boston. Medical assistant is someone that is the first person a patient sees before they see a primary care or an urgent care provider in USA. You are supposed to take intakes, do vitals, collect blood, give vaccinations, give injections, and all of the basic tasks that you would see a nurse or a patient care technician do in an inpatient setting is what you do as a medical assistant in an outpatient setting. I can only say that I was able to secure these positions because of my rapport with my dean and faculty, and it is so, so important for us to nurture and network with these amazing, amazing resources on campus, and at the same time make sure that they are giving you all the valuable support that you need to get the experiences that you want. For me, it was research has always been very integrated into anything I do. And for that reason, I, in both of my experiences, was involved in writing a summary paper at the end of the semester, identifying components within healthcare that I wish in both of these settings that I could make it better and what interventions would I introduce. And on doing that, I was able to still consolidate and connect my curriculum into my clinical experience, which made me eligible for a specific kind of class that I could take within research classes and facilitate this position again under CPT. So you must connect with your dean and your faculty and always, always, always keep the international office in the loop for whatever you want to do, because this support system together is what is going to help you get those opportunities and excel in those opportunities going forward. If you guys have any questions about anything, I am going to be in the Boston for the upcoming year after I graduate, and I would love, love, love to hear any questions you have and answer any queries or concerns you have about the university that I so dearly call my home now. Thank you.
That was just fantastic. Ashna has been so successful at MCPHS. We're now going to go on to Alicia. Alicia, can you introduce yourself and tell us about your experiences in the pharmaceutics program and your various experiences outside the classroom?
Oh, hello everyone. My name is Alisha Patel and I'm a graduate student from Masters in Pharmaceutics at MCPHS University. I'm from India, and the languages that I speak is Gujarati, Hindi, and English. My role over here is to work as a research student because I'm a thesis-based student at MCPHS, and so there are basically two different parts in pharmaceutics or other graduate sciences, which is thesis and non-thesis, and I'm a part of a thesis student, so it is mandatory for me to submit a research project of my own, which I have worked individually throughout the time of me being at MCPHS with my advisor, and submit that, defend my thesis, and finally graduate with that thesis. For non-thesis students, it is not mandatory to submit a thesis. They just need to clear their coursework and they can graduate. So this is the basic difference between a thesis and non-thesis students. So my journey started in September 2021, and MCPHS. And over here, we have been given different lab rotations, which we can select our advisor. So there are different professors in the department who are working on 3D printing or nanoparticles or pharmacokinetic models, or cell culture. So you need to focus where your area of interest is. You need to do different lab rotations with the professors. So this will give you an idea like where you are interested in, what is your area of interest, and what is the difference of other areas. Then which is the professor you're willing to work for the next 2 or 3 years. And so this was the way that we were slided into. So I have worked as lab rotations with my seniors, helped them in their projects, worked under the professors, learned different techniques and the different skills which is required to work in the lab. And how to design the experiments, as well as if there is any mistakes, or how is there any difficulty with the instruments, how to analyze those, as well as uh, go away to rectify those mistakes. And this is how this skill which has been needed in the industry as well. So my project, which I'm working on currently, is a multi-drug tablet. We're using 3D printing technique. So I'm formulating three different drugs, which are three antihypertensive drugs, and that is formulated into one tablet using a selective laser sintering method. So this is one of the novel 3D printing technique which I have been using. So MCPHS has fully funded my research, and the instrument which I'm using, which is selective laser sintering, so that 3D printer was also being bought specially for the research which was conducted in our lab. So in here, so as hypertensive patients need to take different medications at one time, and the tablet burden of the patient is very high, and this increases the non-compliance of the treatment. So the aim is to focus on having multiple medications in just one tablet, so that the efficacy of the overall treatment can be increased. So this is a picture of one of my printing methods. So here I have formulated 49 tablets in one go, and so the laser would print on the tablets, and the roller would bring another layer. So there is layer by layer formulation of the tablet. So there are, Paul, you can move to the next slide as well. So there are different work opportunities which have been given at MCPHS. For example, this is my picture of when I was proposing my research to the committee members and different faculties at the department. So and the other picture is me working in the lab with one HPLC instrument, where I need to evaluate the data. So being a thesis student, I have always got a teaching assistantship from the university, and the research was fully funded with the university. So as being a thesis student, the goal is to always focus on the lab and how everything is going on with your thesis project, as well as connecting with your advisor, with your different faculty members, your committee members, as well as your seniors. So speaking from my personal experience, the seniors as well as the faculty members in the department have been very, very kind, and they would be more than happy to welcome you in their office during office hours, and they'll be happy to help you. They'll always look forward, and they'll be like, please, if you have any doubts, any questions, you can always reach out to us. So this was my experience around the seniors as well as faculty who guided me a lot. One more thing is that we are having graduate seminars. So the graduate seminar is basically a combination of people from different disciplines. So I'm a student of pharmaceutics. There would be students and faculties of medicinal chemistry or pharmacology. We all gather in one meeting, and different students from other departments, they would present their research work or any research article, and they would be tested on the questions of the other faculties as well. So being a pharmaceutic student, my approach would not be at pharmacology questions, but I would be put on a spot and made to think that this is how you need to focus as well, because in an industry or in any other lab where you're working, you are going to work in a multidisciplinary committee, and there had to be a collaboration between all of you. Having said that, I have always worked like 4 to 5 hours Monday to Friday in the lab, and the tuition waiver which I have got, that was partial tuition waiver from the university because of my research work that was done. So this was my journey at MCPHS. I am also an international student, and 3 years ago, I was also attending the webinar which was hosted for international students. So I had a lot of questions in my mind: which university to go and which area to go, what is the situation over there, is it good for me to stay at my own country or go over there, how the future opportunities look like. So I understand all those questions. If you have anything that I could help with, please reach out to me. I'll be very happy to help you guys. Thank you.
Thank you so much, Alicia. That was wonderful, really wonderful to hear about your experience and all the different opportunities you've had at MCPHS. The 3D printer in particular is a very expensive piece of equipment, as you know, and not all universities and not all students have access to these types of machines. And I'd like to just reiterate Alicia's last point, which is that if you are interested in learning more about the experience at MCPHS from the perspective of a student, you're more than welcome to contact us, and we can put you in touch with Alicia or any of our other student workers. It's very valuable to hear how things are from the perspective of students themselves. With that said, let's now go on. First of all, I just want to mention that you saw I wrote in the chat box, you are welcome to use the Q&A function here to ask questions, and we'll try to answer those questions as we go through. We want to make this as interactive as possible. Now we're going to go on to Carbonali. He's going to tell us about his experience at MCPHS and what he has done as far as his internships and his various experiences. Carbonali, take it away.
Hello guys, my name is Kurbanali. I'm an international student from Tajikistan. It's very, very far country in Central Asia, and probably like close to some of the countries like China and close to Pakistan and all this. So currently I'm studying medical and molecular biology here at MCPHS Boston campus, and some of the languages that I speak is English, Russian, Turkish, and Tajik, which is also Persian, and my you see like these languages. And yes, I lived in all these countries. Firstly, I lived in Tajikistan, and then we moved to Russia. I lived there several years, and I came back to Turkey. I lived there for several years. I learned their language, and here right now in Boston, Massachusetts. And from this all journeys, I can tell that this all experiences like really teach me to become like more of international person, and I can share mostly with all of you like how does it feel to be like an international students here, and how to find an opportunities, and how MCPHS, me being student at MCPHS, helped me to find these internships. So if we focus right now, me being a student here at MCPHS actually give me a lots of advantages. And one of the key factors that Paul precisely mentioned is the location. And yes, guys, it's one of the most important thing, especially if you are pre-med, if you're going to pharmaceutical schools and you want to do internships. And why? Because unlike in our countries, for example, in Tajikistan, when it comes to the research, it's only private organization that they do research, or it's governmental, and it is very specific. And here in the United States, all the research positions are done by hospitals. So this is like very important. And if we see the location of MCPHS University, it's in the center of Longwood Medical Area, which is one of the best hospitals like Boston Children's Hospital, which is currently one of the best in pediatric hospital in the world. It's 8-time winner of being the best hospital in the world. We have Dana-Farber Cancer Institute, which is top 5 hospitals again in the world. It's all these big gigantic hospitals. Also, like Paul like showed the photo about Pfizer, Moderna, all of them being within the reach. And particularly about my own internship, I'm currently doing my internship at Harvard Medical School with Boston Children's Hospital. So you're asking me like, Kumali, how you are studying in MCPHS and you're doing internship in Harvard Medical School. Again, in United States, when you're studying in one school, it doesn't mean that you are limited to that school. For example, we have in my research, we have students from MIT, we have students, another students will be joining us from MCPHS University, which is also my friend. We have students from graduates from Harvard College, which is in the Cambridge, 20 minutes drive. We have, so these opportunities, you can just apply. And as Alicia like precisely said, how to apply and what's some procedures to do. And you are not just limited to your university. That's like the main point here to take. And you can do your internships. I know my friends doing it, internships in Dana-Farber. I know some people doing it in Massachusetts Institute of Technology, Boston College. It's really like when you are in Boston, it feels like one big home and it's one big institute, and it's all matter of you, how hard you work, and how along you get with your dean's office, with your teachers, particularly because some of the professors here at MCPHS, for example, one of my lab instructors, Andy Zanga, who is also doing a research internship, not research internship, doing research. He's a researcher at Brigham and Women's Hospital, and I'm one of our students like reached him the other day as like professor. He was one of the good students, by the way, as like professor. Uh, we've been like studying for 2 years. You've been my mentor. Is there any possibilities that I could be, under your guidance at Brigham and Women's? And surely after 2 months, I see him doing his internship with the same professor. So this is another advantage of MCPHS you can get, is that the faculty themselves, they are always in the research, they're doing their papers every day. And if you're going to medical school, some of the people I know are interested into doing a internship like myself, and then go to the MD, PhD, which is a physician researcher. One of the right now the most thriving path that is really growing fast in the United States, because we have to understand that medicine 50 years ago, 100 years ago is way different medicine today because in current medical schools, like being even a strong applicant or being a successful doctor, in the future, you need to really know the research side because the science, especially in medical field, as all of you know, is growing really fast. And the best way to be on the top is going with the flow, meaning that you becoming a doctor, you do your surgeries, let's say, and then on the same time being on the lab and doing research because you also want to innovate. You want to push the boundaries basically, and it's only possible when you are doing these researchers in the big hospitals. Because, for example, one of the microscopes that I used is a confocal microscope, for example, and it costs nearly like $800,000 to $1 million. And then we just have access to that. We can do our latest samples to check with those kind of microscope and get the best pictures for the microscope and see how, let's say, tumors are invading into the normal cells. And I'm pretty sure that this kind of microscope, this kind of resources, it's very, very limited in the countries that at least I lived, and it's not like that easy. You go and take a picture, for example, what you want to do for confocal microscopes or anything like this. So it's really important. How they say it's right place, right? So one of the factors to be successful is right place, right time, and right people. So if you have your professors and if you are in MCPHS, for example, it's a right place. You have to just find the right time, which is right now, especially when biomedical field is thriving so much and that the healthcare is changing so much, and being in this hub is very, very crucial. And also one of the other things that you get as an advantage at MCPHS, and I forgot to put it in the slide, is getting to the societies. So for example, I'm part of a society of neuro-oncology, and I was really surprised to know that being MCPHS students actually like waive a lot of fees. For example, the membership costs around like $800 or so. And then as a MCPHS university student, I was able to waive that fee as a student member, and I got my membership there, and then I visited, and it's the best place for networking, because networking is another like crucial thing. Because once you are working here, and then before going like after graduating the school, you want to have all these connections. So imagine that you already work 1 year or 2 year internship in, let's say, uh, Boston Children's Hospital or any other hospital. um, it's surely like way easier to get into like this OPT program, optional practical training, that also like I think Ashna talked about, and CPT, which is curriculum practical training. It's really easy to get work after the university, which is, I know that very, very crucial for especially international students to get the experience there and apply the knowledge that they have gained through out the school. And the prime example for me is myself, because the other day I was talking with my PI, which is principal investigator, is basically the big person here in the lab that manages everything from the starting of the lab till how the research is going, and manages give us the questions basically for us to solve. And he basically said that like in the summer, for example, and I was about to go home because I didn't know, I don't have classes, and I was thinking like I don't have opportunity to work. But I again connected with the deans of student. I'm like, hey, like my research is going on and I don't want to stop it. And they gave me a class. For example, Dr. Tryford give me one credit class that was actually talking about undergraduate research program. And I will be continuing my research also this summer. And let's talk a little bit more in depth about my research. Thank you, Paul. So my research, as I mentioned, is in Harvard Medical School, collaboration with Boston Children's Hospital. And our lab's name in our department, every lab has like a name for themselves to identify themselves and what they're working. So our lab's name is Tanks Lab, and it is devoted to the name of our founder and our current PI, Dr. Shin Tang. And some of the activities I'm personally doing is, for example, as you see, PCR and agrojet electrophoresis. That's every single student who is like at MCPHS will learn this in Bio 1 even, which is going to the Tanks lab at Harvard and Boston Children's Hospital. It was really easy to kind of adjust into the schedule because I already have these experiences, and my professor has taught me really nicely. And it is when you start learning plasmid DNA isolation that I think we did plasmid DNA isolation our like few beginning classes here at MCPHS. And again, when plasmid DNA isolation in Boston Children's Hospital, of course, it was more advanced, but I already knew the basics for this. So it was very easier to adjust to the schedule. And immunotechniques and cryosection, again, it's very important techniques. And our big project, so I want to talk about, this was the techniques that are like, some of the techniques we are using. And our project investigates, for example, the root of brain disease at a molecular, cellular, and network level. We focus specifically on neurodevelopment disorders, epilepsy, and brain tumors, which is one of the devastating diseases for the kids because as I already mentioned, Boston Children's Hospital is a pediatric hospital. We are aiming to develop precision medicine therapeutics, and our goal is to find not only treatments, but potential cures for these devastating diseases. We believe the key to groundbreaking therapies lies in foundational sciences. We use cutting-edge technologies like single-cell RNA sequences, CRISPR gene editing, which is most of us heard, and I always dreamed about this to work with CRISPR gene because it's not only very expensive. How can I put it in the word? It's unaffordable for most of the institutes around the world to do CRISPR gene editing, and it's very difficult because you basically edit the gene, the normal gene in the human system, and we basically do it like in the small animals like mouse and rat, it's very fascinating. And also we use organoid cultures to study genome editing human stem cells. So this helps us to answer crucial questions like can we halt or reverse neurodevelopment disorders after they have begun? Can we find drugs that target the range of brain diseases? How can we accurately model the brain immune environment in the lab? So through collaboration with the Department of Neurosurgery and Harvard Medical School, and of course MCPHS University, who also gives us a lot of grants. I remember this semester, oh no, this year basically, this season, they gave up 12 mini grants for 12 students in the amount of $3,000 to $5,000, I believe, which was really fascinating to see these undergraduate students and master students getting involved and getting these scholarships to put in to basically like work from there, which is really important for any institute. And our mission is in Boston Children's right now is to translate our research discoveries directly into treatment for brain disorders, pushing up close to cures for these uh, disability conditions, which is very difficult conditions that unfortunately few people, mostly it happens to the infants. There's what's called brain tumors, and it's a very low chance of survival, and we really hope to accomplish our mission. And also one of the other thing, like really good thing while being in these hospitals, is that you will get your name into the publications. So what does it mean? Once you get your name in the publication, and guys, I will be honest with you, they don't post their publication in small journals. When you do all this, basically what I say, groundbreaking, maybe it will sound really fancy, but it's not actually. It's real. It's real because once your name gets into some journals like Nature or New England Journal of Medicine or all these really like good journals, it will be there forever. What does it mean? It means that you go anywhere in the world after, let's say, you decided to go to, continue your research in finishing MCPHS and go to any other university, this is gonna follow you. Uh, Once people like open your resume and they see that you worked in Boston Children's Hospital, in Mass General Hospital like Ashna, or you did work with Alicia, for example, who already did pharmaceuticals in MCPHS University, which is one of the best and one of the oldest school here at Boston. I think it's the oldest higher school here in Boston. They will see all this, and it really matters, and it will help you to grow, and it will really help you to get this networking and hopefully help you in the future. If there is any more questions, Paul.
Carbonali, that was really, really thoughtful and comprehensive, and I really appreciate you sharing your experience with everyone. I think you brought up a really good point about the next gen DNA editing and those types of new types of research that are available. And even with Alicia's research on the 3D printing, a lot of this is cost prohibitive for students overseas because these types of machines and this type of equipment and the type of research that you're doing, it's really only available in certain locations, certain hospitals who have the budgets to really invest in this type of research. It's a major undertaking that you can't just do. You really have to plan and invest for it. So it may be cost prohibitive for students in other countries, but if you're in Boston, where most of the funding from the National Institutes of Health is going, a lot of venture capital funding is going, the investment is already taking place, and the landscape is set for you to really begin identifying the right areas of research and areas within the health sciences that you want to begin investigating to see if it's worth pursuing for your career. So the landscape is set. The investments have been made. It's just really a matter of taking the leap and taking advantage of what we have here in Boston and greater Massachusetts. We have campuses, of course, in Worcester, Massachusetts, as well as Manchester, New Hampshire as well. Don't forget about them. I'm going to show a video. Carbonali did a video for us that we shared on Instagram. I thought it was really nice how he did it. Just kind of give you more of a visual idea of kind of how he spends his day. I'm going to share that with you right now.
Hello guys, I'm Kurbanli, an international student at MCPHS, interning in research neurosurgery at Boston Children's Hospital with Harvard Medical School. Our lab specializes in innovative therapies targeting brain disease like cancer with the goal of discovering effective treatments. Now it's time to dive into today's agenda. I will begin with cryosectioning, which means first retrieving organoid cells from our refrigerator and then transferring them to the cryostat machine. Then it's light on and focus time. I'll be cutting the samples into precise 14 micrometer sections. This step requires utmost care to fully extract the organoid without losing any samples, as even a small loss can impact our data. Finally, each careful sliced sample will be meticulously attached to an empty slide, ready for the next phase of our research. Besides cryosectioning, I also do clone picking. It's a bit like detective work where we select specific cells to better understand diseases. This is crucial for developing a new brain disease treatment. Lastly, in my day, I concentrate on mini and maxi prep, crucial for DNA isolation. Mini prep gives us quick DNA samples for rapid analysis, and maxi prep produces large amounts for in-depth research. My dream is to become a top neurosurgeon. Every day here brings me closer. Thanks for sharing this part of my journey. And to end, check out this amazing East Boston view from our lab. It's all about reaching new heights and making dreams reality.
That's just really exciting to see you in action, Carbonali, and we're so proud of you. Some students have asked, okay, well, what is the exact procedure for getting an internship like this when I arrive on campus? And the truth really is that there is no secret formula. There really is not. It really takes persistence, perseverance, networking, understanding who in your field of study is doing the research that you want to be involved in, who's publishing articles, and making them aware that you're very interested in helping them. So I just want to put that out there. Internships and research is not something that's guaranteed by any means, but it's very important in the health sciences. You cannot continue on and go to medical school or go on to a graduate program in pharmaceutics or some type of advanced research without actually doing the research yourself, without actually being involved in the industry, right? That it's hard to get a first job without understanding the landscape itself. So get involved, learn who to connect with, and be very active. Spend your time when you're not studying, participating in industry events. And this is why our faculty is available. They're obviously to teach you because they're professors, but they're also very well connected locally in around our various campuses, but also nationally and internationally as well. We have professors that are doing research in overseas. If you can, we receive emails very regularly about our professors kind of active research in various areas. So they're there to support you. They understand that you're at MCPHS not just to do well academically, but to build a career. And part of that is getting these types of experiences that you've seen from Carbonali and Alicia. Just a few more things on the strategies for securing internships. Do a self-assessment, figure out what you want, put a plan together, understand what the campus resources are that are available. We have online platforms through our career center. And it's important to stay organized. And as I said, be very persistent and prepare. This is really important. You're not the only one going through these types of interviews and these types of pursuits. So connect with other students, connect with faculty members, and especially connect with the people who are doing the jobs that you want to be doing. Learn how they secured those internships, those jobs, and most of the time they're very willing to offer their advice and help you out because that's just how we work at MCPHS. We just want to help each other succeed. This is just a kind of an inventory of internships that students have done and various projects that students have done over the past few years throughout the greater Boston area and at other locations throughout the United States. You'll see that there's a wide variety of different types of projects that students have done, a few in clinical research, a few using kind of unique technological innovations. Many have addressed a wide variety of different diseases and developing new therapies. There's one there for Alzheimer's disease. Many students have worked on oncology and cancer therapies. So it's really exciting what our students have done, and we're just very proud of them. This slide here, I want to just show you some other examples of some students who have done really well, who have really excelled by getting internships, doing research, and then leveraging those experiences to get their first jobs. Hugh here is a great example. He came in to MCPHS a few years ago planning to go to medical school, but got really involved in research. He worked at Harvard Medical School doing research at their stem cell institute. And then he pivoted and ended up getting a job as a research scientist. His first year after MCPHS, he was a research scientist at Vertex Pharmaceuticals. And last time I spoke with him, he was planning on still applying to medical school, but he's going to have such a strong application because of his experience as a research scientist at Vertex. We have many other students as well who are at biotechnology companies. The student here, Hylam Kim, is at Pine Tree Therapeutics. She's an associate project manager. We have other students who are doing different types of research at different biotechnology companies. Shilton here from South Africa actually is a clinical research manager at the Joslin Diabetes Center, which is affiliated with Harvard Medical School. Novartis, which you probably know. Brigham and Women's Hospital, which is close to us. The Dana-Farber Cancer Research Institute. These are highly coveted jobs that our students are able to. This is not an internship. The student is working as a clinical research coordinator at Dana-Farber Cancer Institute, looking to develop new ways to treat cancer. I mean, there's really nothing more important than that. And then this student here is working as an associate director at Merck, which, as you probably know, is one of the biggest pharmaceutical companies in the United States. Are these programs STEM eligible? Most of them are. A good number of them are. I want to read you the ones that are. So STEM means that you're eligible to work after completing your degree. You get really up to 3 years. The programs that are STEM eligible are medical and molecular biology, chemistry, biotechnology, and health information management and technology. Data science, there's 2 data science programs that are eligible. And the PharmD program is now a STEM program as well. And those are just the bachelor's degree programs. We also have many master's and PhD programs that are also STEM eligible. And again, the point is that you're getting the experience you need after completing your academic studies to move on to the next step. So remember, you want to be asking the right questions. How will my choice of major help me get into graduate school or medical school or land me my first job? When was the curriculum designed, and does it take into account the latest trends in industry and the various health sciences sectors? What kind of lab and research opportunities are available? Does the program offer hands-on experience and research? What systems are in place for students to get connected with the job market? These are all really important questions to be asking, whatever university that you're speaking with. We just have a few minutes. We'll allocate a few minutes for a Q&A, but if you have not applied yet, but you are interested in applying, you can take a picture of this QR code. It'll take you right to our online application. The admissions office is here to work with you, to answer your questions, to help you with the application process. Don't hesitate to reach out to us. We hope that this was a really helpful discussion. Remember, we're here for a resource as you kind of navigate the landscape of health sciences and the various universities that offer the majors that you're looking into. Thank you so much for listening. We will now look at the Q&A box to see if there's any questions. Carbonali, Alicia, did you want to add anything else?
Hello, I want to answer one of the questions that asked. I feel it's like a more close to Alicia, but I can answer it too. It said that what kind of internships can students with masters in pharmacology, any course with non-thesis track can apply for, since we do not get exposure to the labs during our course time? And I think it's a very good question asked, since like they're not doing the thesis and they're thinking like what kind. And I'm being honest with you, it's anonymous. I was thinking to say the name, but it's anonymous. Um, there is no limit for that. You can literally do anything you want. Like you can apply to any kind of internships you want. And what's the good about this is that you are not limited. I mean, at least you are limited, okay, by 30 hospitals like around Boston and Massachusetts. That's not a real limit, okay? So you can apply to biology. I know a lot of pharmaceuticals because pharmacy, it's the one basically we are doing. One of our students who are the graduate did his master's in pharmacology or pharmacopoeia, I think, and right now doing uh, our research with us. There is no limits, honestly. You can if you are in pharmacology or biology or any STEM related subjects, you can literally do anything. You can even go to neuro-oncology, and yes, there is no limits, and you can apply as much as you want. And I'm being honest with you, there are a lot of opportunities here if you're studying at MCPHS.
Yeah, that's
Uh,
a great point. Go ahead, Alicia.
As I was just wanted to add that that was very rightly said. I was just about to say that there is no limit while you apply for different internship opportunities. There are two types of opportunities, which is one, you get a 3-month internship, and there's a co-op opportunity too, where you get a 6-month experience. So there are examples like you can go to different research associate positions for co-op or internships, like oncology department or any biology department. There's a therapeutical area science department as well in different industries. So not only targeting industries, but there are different hospitals and research laboratories around the campus as well. So there is an advantage of the location when you come to MCPHS for and look for some different research opportunities. While saying for non-thesis people who do not get any lab exposure inside the university, that is true, but you can always focus on getting any internship or co-op opportunity, because you do not have the burden of the thesis work which has to be completed before you graduate. So once you are done with your coursework, you have the summer where you are not taking any courses. So there is a vacation for 4 months. If you're not planning to travel, you can always look for internships or co-op opportunities right from the beginning of January or February, maybe. So you can start working from May. So you get May, June, July, and August. This 4 months you can plan on working as an intern and trying to gain every single exposure and the experience that you can get from the internship.
Yep. Thank you so much. We've run out of time. The point that Alicia and Carbonali have made is that you're not limited to what's in your curriculum. The opportunities here really are seemingly limitless. But we look forward to working with you. Go ahead and submit your application if you have not done so. Don't hesitate to contact us if you need help. Thank you so much. Have a good day, everybody. Bye-bye.